Welcome, everybody. This is Paragon Physical Medicine, and this is our podcast. And today I have with me Dr. Ciera Chaffee. I'm Dr. Bryce Ciera, clinic director. Ciera is the office manager. And because we come from a chiropractic family, there's so many different things we can talk about, so many conditions that we treat, so many things that we do. But I think the first thing that's important is that when people come to our office, it's important to know what they're going to expect. So tell me what your thoughts are on that. What should they expect?
Well, we're a very different office than many other offices only because we have an open concept. Part of our philosophy is trying to allow people to be open so that they don't feel closed in or in a closed room like a typical doctor's office. We have many different parts of our office, and I think when people walk in, because it is beautiful and it is different than walking into a sad, dimly lit place that is like doom and gloom.
Yeah.
Ours is very bright and very open. So everyone's like, it's like a wow factor. And they're like, whoa, I was not expecting that.
And, patients tell us all the time, when they walk in the door, you can see their eyes kind of like, wow, there's a lot going on here. They see people getting IVs. They see people doing decompression. They see people doing stretching. They see people getting adjusted. They see people filling out paperwork. They see kids running around. They hear babies. I mean, there's just a lot going on. It's definitely not your typical doctor's office, that's for sure. And I think it's super cool. And the concept of that is to bring community with our folks. And, we had 10, 12 rooms in there when we first built the building. Then eventually just tore them out because you're isolating like 12 people. And I think that's just, how do you connect with people when you're all closed in like that, going room to room? And, I don't go to the doctor very much, but the few times that I do, it's like I'm sitting there waiting like, okay, it's been 20 minutes, 30 minutes, 40 minutes, 50 minutes. I'm like, holy cow, this is crazy.
Yeah.
And so I want to take that completely out. And plus, it's good for people to see what other people are doing, because most people that come to see us have similar kind of problems.
And the closed room environment, you don't always see everyone that comes in, and people know each other. So then when they see each other, they're like, okay, I know that person and they go here. I think this is a good place for me to be. And they don't feel so intimidated.
Yeah, and I think it is cool when somebody comes in and they see somebody that they actually know, which happens all the time. They sit down and talk with them, somebody they haven't seen in years. And also you come into the county fair kind of sometimes, and they sit there and just talk and talk. But then there's a lot of people just make friends there. There's one friend of mine in Indiana. This one guy was a patient, this girl was a patient, and they met there and they got engaged and they actually got married in his office.
Oh my gosh.
So
I didn't know.
We haven't had that yet, but I don't know. Could be a thing. You never know. So walk us through what happens when they first come in.
We have a lot of different options for people when they first come in as far as what to do first. We have an amazing front desk. They really help the patient move along with the paperwork, with answering phone calls, and giving them the things they need to fill out so the doctor's ready to see them. So they will come in, they'll sign in, and then we'll give them paperwork. We always greet them, and they're always shocked that we know their names. And that's because we're expecting them. And when they know that they're being expected, it helps them feel warmed and welcomed instead of, opening a door and be like, okay, what's your name? It's like, that you've never seen me before. I'm new. So obviously I'm the next new patient that you're having on your schedule. And because we have that open environment, we're able to be open with that person. They don't feel so like, oh, can I ask them a question or not? So we'll give them intake paperwork, and then we always have welcome bags, and that has all the information from our office, the things that we do in that bag, so they can take that home. Has a welcome letter. We always give them like a little ice pack with our logo on it, and they just enjoy that gift. Like, okay, they want me to be here. They want to give me all the information that's going to help me. And sometimes that seems overwhelming to them, but they eventually if they want to get better and they want to improve in their health, they're going to try and do as much as they can. And then we have special rooms for the new patients, and our case manager will go in, she'll do the history, to try and get to know that patient, and then we go on from there.
Yeah, and then we do a complete chiropractic, neurologic, and orthopedic exam, what the chiro does. Then he leaves, our medical team comes in, our nurse practitioner comes in, does her medical exam, and then we go to x-ray. And then sometimes we adjust that patient that day, sometimes we don't, depends on what their situation is. And then we always have them come back the next day. In between that visit and the next day, the chiro team, the medical team meet. We have a special meeting room with a huge big screen TV, and we go over all the x-rays bone by bone. And then we sit there and talk about the patient, talk about their history, what they've done, their whole life, and then we put together a really amazing treatment plan for that patient. Because we have so many different tools in our office, we can pick from all these different tools in a toolbox, because it's necessary to have lots of tools, because not everybody's the same. Everybody comes different. And so we put together this super cool plan, and there's some different levels of it. And then the patient comes back, then we go over the x-rays thoroughly with them, and then give them the opportunity to get healthy if they choose to.
Yeah.
And that's the most fun part, is when you introduce people to natural health care. And the way that we do it, it's so awesome, because most of the time we get rid of pain very quickly. And people come to us for like pain, right?
Right.
That's the main thing to come for. They don't come because they hate. I think I looked in the mirror this morning, my back's all bent out of shape. That's not true. They come because of severe pain. And of course, that's that's our first goal, is get rid of the pain, because we know that's why they're coming in. But then you got to go deeper and figure out the cause of that pain. And that's what we're really good at. And now that we have all the information, we've done all the neural testing, the ortho test at x-rays, and we do lots of blood work too, like functional medicine, nutrition, all that stuff if we have to. So we have all these tools that we can use. And, and people love it. Those people who really want to work on their health to get the most out of their life.
Right. Yeah. And we offer so many things that it can seem overwhelming at first, but then people start to see that they improve and they get better, and they're like, okay, what can I do next to help myself? And we're kind of like the one-stop shop almost. We're last people's place they come to, because they've been everywhere, and people they don't know what to do. And so that's why we're kind of like that rope of hope. We kind of show them a non-medical route. They have all the other options, and we give them another option, and they're like, okay, maybe I should try this.
Yeah, that's true. I think, like you're saying, most people come in after they've done like everything. They've been to neuro, they've been to ortho, they've been to pain management, maybe a couple pain managements, and their family doctor. They've been everywhere. And yeah, and you're right. We're like the underdog. And to us, those things, people think that when they come in and we adjust for the first time and they feel amazing, they're like, man, I can't believe this. I should have been here a long time ago. And we hear that all the time.
Yeah.
Well, it's not their fault. You just don't know if you don't know.
Yeah.
But it's important for us to find everything out about that patient. Everything that we can tell, because you got to look at all the three stressors of their life: the physical stress, the emotional stress, and the chemical stress. And those three things is what brings people in. And I think this current time that we live in, emotional stress is huge. And that goes in, especially if you're on your phone a lot and you're watching all the stuff that's going on. It has to come out somewhere. And it's going to come out somewhere in your neck, your back. It helps you, makes you not sleep, you don't feel good, all these kind of things. And so we're seeing definitely a shift of issues. It was 20 years ago, we didn't worry about phones and Facebook and YouTube. And that wasn't even a thing. People just went to work. When they drove home, radio was playing, window was rolled down. You just relaxed your brain. But now it's a whole different world now. It's just the way it is. So we just have to deal with things differently now.
Yeah.
With people. So I think that's a super cool part. But yeah, and taking people through that process. Some people are like, can we just get to the adjusting part? Well, I get it. But you just can't throw somebody on a table and start whacking on them.
Yeah.
Yep, there's a lot of guys out there that do that. They won't do the thorough exam. They won't do, because if you miss one thing on that one person, it could be a bad day. Yeah. And we are never going to do that. They can go somewhere else. There's plenty of guys up the road, whack it for $20, and we're just not doing that.
Yeah.
And it also tells me those people really aren't interested in like health. They just want to get rid of pain. And yeah, people do use it sometime as a chiropractic aspirin, and there's no good end to that. It's just a couple of days, then it's back. Like, chiropractic didn't help me. Oh yeah, of course it didn't, because you didn't do anything,
Yeah.
And so, but most people who we do see love coming in, love doing all these things. And I think it's just great. And we built such a huge community in this community, that it's just, it's a place where people come to find hope. We always try to say things in the lift them up, and a lot of people we've seen for almost 30 years, over 30 years, and they're like family. And that's the best part, is coming in the morning. I can see people that, I see like once a month, every 2 or 3 weeks, I've seen for years. And I get to catch up on their kids. And now we're at the point where people we saw 30 years ago, that, they had small kids, and those kids are married, and then they have kids. And so now we're seeing like the four generation family: the grandma, the mom, the daughter, and the daughter's kids.
Hmm.
And so it's just super cool. You see all, like, the whole family comes in
Yeah, it's
like that.
amazing.
And that's super cool, because they understand how healthcare starts with the nervous system from the inside out.